There are much bigger investments in other areas of medical research. It would be good to see increased investment in mental health research of the order that we see in cancer research, and also the investments that we see in other areas like aged care and in pharmaceuticals and in Medicare. Mental health is still a relatively small player compared with those other big investments in health. And perhaps one of the issues for mental health is to be part of the big changes in healthcare, not just a separate piece of the budget directly devoted to mental health care alone.
A couple of things from an infrastructure and architecture of the sector that are part of this budget that are very, very important. The most important of those is a suicide prevention special advisor in Prime Minister and Cabinet. The role will take a whole of government approach across portfolios, recognising that suicide prevention is more than just a mental health issue. So we're delighted that that's been addressed. The other very important piece of infrastructure is addressing the issue of data and making sure that there's available data, both lead data and lag data, so that communities can address issues.
We also believe that the $152 million will provide opportunities for reviewing current processes within centres, improving the quality of work, not just the access to services for young people. And also the funding will enable what centres have been calling for, and that is a closer alignment between our online platforms such as eHeadspace and the Headspace Centre networks.
We welcome the announcement of funding and focus on the workplace, and in particular the investment the government is making in supporting workplaces to ensure mentally healthy workplaces, and that individuals are supported early on when they may be experiencing mental health problems.
Grateful and happy that there's initiatives to invest in perinatal mental health. I think that's been underfunded for a number of years. I think a system of diversion from emergency departments into community mental health hubs is also a good initiative. I am somewhat disappointed in the investment into Indigenous suicide and Indigenous mental health.
Again, it's really, really critical and important to be investing in preventive practices to prevent chronic health disease across the lifespan. But again, mental health was a key missing issue in government's investment into prevention. We have really strong evidence coming from Australia about what we need to do in order to prevent, as well as intervene early across the range of mental illness and related issues. And we didn't see any specific investment into those initiatives or the expansion or scaling up of those initiatives in tonight's budget, like we did for, in say, cardiovascular disease and the cancers. So I'm looking forward to working with the government going forward on increasing investment and action in those particular areas.